And we are back on this Zero Hour. I am Richard RJ Eskow, and our next guest does terrific work in the field of economics. I follow her work closely. Elise Gould is senior economist and director of health policy research at the Economic Policy Institute. Her research areas include wages, poverty, inequality, economic mobility, and healthcare. Elise, thanks so much for joining us. Elise?
Yes.
Thanks so much for joining us.
Thanks for having me.
Now, you have co-authored a new paper that I think is really important, would love to bring to people's attention, entitled High Quality Child Care is Out of Reach for Working Families, and you kind of reveal your conclusion in the title there. When you say that it's out of reach for working families, what precisely do you mean? What did you find in doing this report?
So by out of reach, what we're talking about is that it's just simply not affordable. And we're not just talking about low-income families. We're talking about moderate income, middle-income families. We look at child care affordability on a variety of different ways and look at how families simply can't afford it.
So you found some striking things in this report, one of which, so you looked at, I think it was 618 different communities and costs, as opposed to what, median wages in those areas? Is that how you did it?
We're looking at our family budget areas, which you're right, it's 618 different areas, so metro areas and rural areas across the country. It encompasses the entire United States, actually. And what we do is we look at our child care cost component of family budgets, and we compare and we look at whether or not people can really make ends meet there, and whether or not they can cover their child care costs, and what share of their family budgets have to go towards child care costs. And it is very high. It is very high for many people to afford child care. Very hard.
The government has set some standards of affordability for child care in this country, and I think the primary one is that child care be no more than, and preferably less than, 10% of household income, if I've got it correctly. And I think you found that that's very rarely the case, that it meets that affordability standard. Is that right?
That's exactly right. It is very rarely the case that families can meet that affordability standard, particularly if they have very young children in their household. It's going to be very hard. 4-year-old care is expensive, but infant care is even more expensive.
So, and another finding that I considered very striking, well, there were several others, but one of them that really hit me, that I think people need to hear, and we're talking with Elise Gould, economist with the Economic Policy Institute, is that in a large number of areas, the cost of child care, or even in more cases, the cost of early childhood care, is greater than the cost of tuition at a public college or university. Do I have that right?
That's exactly right. In 33 states in the District of Columbia, it costs more to provide infant care than it does for in-state tuition for college. And it's really interesting when you think about middle and upper income families, when they're trying to save for college, they have 18 years, presumably, right, from 0 to 18 after a child is born, to try to cover those costs. But if they think about earlier in their careers, when they're on average going to be younger, they're going to be making less money. They all of a sudden have an infant, and now they have to pay just as much money as they'd have to pay for in-state college tuition. It's mind-boggling, really, to think about how people actually afford that.
And another way that this struck me as a terrible squeeze, Elise Gould, was that if I remember correctly, my data on this, I think we're the only developed nation in the world that doesn't provide some form of paid leave for new parents. So it seems to me that if that's correct, that new American parents are in the unique situation of kind of being forced by financial circumstances to go back to work, and yet faced with early childhood child care that is enormously expensive.
Yes, it's absolutely increasingly the case that both parents need to be working. If you have two parents in the household, need to be working to make ends meet. And so for that to be the case, then you need to figure out what you're going to do with your kid. And we do not have paid parental leave in any meaningful way across this country. There are no laws in most places across this country that cover parents. And so they take a minimum of how much they can either save up on their sick time or vacation time, and then they're back to work. And then they need to find care for their kids. And that care can be quite expensive for them to cover.
Now, do we have a philosophical difference with other developed countries in this area, do you think? I mean, why is it that it's much more common? It's not universal by any means, but that it's more common in other developed countries to see greater government subsidy for affordable child care and general, again, maybe United Kingdom, a couple other places are exceptions, but generally more affordable health care than we have here, or child care rather. Is it that it's something we don't see as fundamental to the family unit and other countries do? Why do you think there's a variance? Got any ideas?
Well, I think the policies that we have in our country are going to be partially reflective of what we believe about the economic system and whether or not it reflects our values. The fact that we do not have paid parental leave, the fact that we do not have affordable childcare across the board does have a cost on our economy, does have a cost on particularly women's labor force participation. And that's really too bad. I think if we were to reform the system, if we were to make it easier for parents to take off, both moms and dads to take off, I think that would be great for children. That would be great for the parents. I think that if we had a system where they could have better access to affordable, high-quality childcare, that would be great for kids. That would be great for parents.
And how does this how do your findings intersect with the fact that there's so much, there's a relatively high degree of childhood poverty in this country? More than one American child in five lives in poverty, including 38.2% of African American children, and so on. To what extent does the issue of affordable child care intersect with the issue of child poverty?
Well, when we think about childcare, we think about who really needs it, who needs to have it be affordable. Obviously, you're talking about low and moderate income families. If we're also interested in making sure that kids are ready for kindergarten, we want to think about childcare that provides some early childhood education as well, and that can help make sure those kids are ready, help for the economy in the future, and help close those achievement gaps that are there.
What about the health of children? To what extent? I don't know if you've looked at this, Elise Gould, but to what extent is the health of a young child influenced, whether an impoverished child or just children in general, mental and physical health impacted by the availability of quality child care?
That's a great question. I haven't looked at that specifically, but I know that when parents have irregular schedules, it can be hard for them to find childcare for their kids. That can add stress on their lives, and that can absolutely have physical and mental components to that stress will be harmful to children.
What other areas, or rather, I should say, what other findings in this area stuck out at you or struck you when you were doing this research? I mean, I found the comparison with public college tuition especially striking. Anything else strike you?
Yes, there's two other things that we do in the paper. One is to compare rent, so how much it costs to pay for housing and how much it costs for childcare. And we find in our family budget areas, 618 of them, 500 out of 618 of them, rent is actually less than childcare. So families have to spend more on childcare than they do on rent, and that's pretty striking. And then we think about families at the more bottom of the income distribution, minimum wage families, so workers, parents that pay them are making only the minimum wage. You can take a very large share of their annual earnings to be able to just afford childcare. So if we look at the median minimum wage area, that happens to be Hawaii, nothing particularly unique about that. It just happens to be in the state of Hawaii. And you were to say that they were making full-time, full year on the minimum wage, it would take them from January through September, every penny of their earnings from January through September, just to pay for infant care costs for their family. So obviously it is out of reach. It is unaffordable for those families.
So that's 9 months out of a 12-month year, just to pay for infant care costs. So what are the solutions here? I mean, I know it's kind of outside the purview of your analysis to talk about solutions to this problem, but you have any thoughts on how we might address that?
Well, I think the flip side of this problem is that childcare workers are not paid enough necessarily either. And so it's not necessarily that childcare is too expensive, it's that it's not affordable. And if we want to have high quality, dependable childcare, then we need to make sure that we have high quality workers, which cost money as well. And so it is the kind of problem that can be dealt with pretty substantial government intervention. I don't have any particular solutions in mind, but I think that when policymakers look to try to get solutions to this childcare crisis, they should think about solutions that are at the scale of the problem. And the scale of the problem that I'm researching now suggests that it is very big, and we need to figure out ways to make high quality childcare more affordable for families.
I couldn't agree more, and I think that one of the things that struck me also in reading your report. So I went back and took a look at it. UNICEF, the Innocenti Research Center there, has a series of 10 goals or benchmarks for good national early childhood education and childcare programs. And I looked at it. The Nordic countries meet between 8 and 9 of the benchmarks. The United States meets only 3, and some of them include a well-coordinated plan for accreditation, for training, for support of these workers, and so on. But that's only half the equation. I think that's part of what you're alluding to here. Half the equation is subsidizing and providing adequate childcare to everyone, especially those who can't afford it, which is a lot of people. But the flip side of it, isn't it addressing the inequality that leads to these low wages of the parents who have to pay these costs?
Right, right. You want to definitely look at both sides of that equation.
Okay, so any other closing thoughts that you have for us on this report, which again I think is very, very important?
Thank you so much for highlighting it. I just want to let you know that next month I'll be putting out a report similarly looking at childcare, but looking at it from the worker perspective and looking at childcare wages in particular and seeing whether or not they can make ends meet.
Well, I think that's also very important, and I hope the end result of all this is an integrated sort of 360-degree view of this problem, which it sounds like what you're going for. So Elise Gould, senior economist with the Economic Policy Institute, co-author of High Quality Childcare is Out of Reach for Working Families. Thanks so much for joining us.
Thanks for having me.